Yeah, the widowmaker sounds really scary, and it is scary. And the reason that that name sort of came about is because it's the left anterior descending artery, the artery that runs down the front of the heart. It supplies, a large majority of the heart muscle, the left ventricle, which is the pumping chamber of the heart. And in the past, blockages or heart attacks in this particular blood vessel could quickly prove to be fatal because of arrhythmias or because of, congestive heart failure, shock, or cardiac arrest, because it is such an important artery. So when Ray Romano talks about having a blockage in his widowmaker, we worry about that widowmaker because that's not a blockage you can sort of leave unattended. And oftentimes, we don't necessarily have symptoms from a blockage that's slowly building up over time. So when it comes to blockages, there's sort of two ways that it manifests itself. One is that the blockage gets bigger and bigger over time, and then slowly you start to have symptoms like shortness of breath or chest pain or exercise intolerance when you need more oxygen and your heart can't actually supply that oxygen because of that fixed blockage. That's what happened with Ray Romano. So he started to having some chest pains while he was on set filming, and then that prompted a workup, and that led to discovery of the blockage. Once in a rare while, we'll find somebody having a blockage in their widowmaker because it got picked up on a stress test done for some other reason before surgery or what have you. And then, of course, we never want to find a widowmaker blockage when it manifests with a heart attack, which is a complete occlusion. So that's the situation that you want to avoid. You really want to try to find it when you can do something about it, not when it's completely shut down. Yeah, it's kind of crazy. All my patients tell me, well, I'm going to work on my diet and I'm going to, get my cholesterol down the good old fashioned way. And what we really learned in the world of preventive cardiology is that cholesterol is a toxin to the arteries. It is poison to the arteries. And so leaving it elevated, even at a mild to moderate level for a longer period of time, can substantially increase your risk of developing a blockage. Once you develop that blockage, it's really hard to take that cholesterol out of the artery. All you can do is really prevent more from depositing. So treating cholesterol, elevated cholesterol, even if it's mild to moderately elevated early in your life, treating it aggressively and treating it for a longer period is how we're going to keep those arteries nice and clean. I wish it was more effective than it is. And the reason for that is because only about 25% of our cholesterol in our body comes from our diet. About 75% comes from our genetic set point, like what our liver makes. Now, the liver and the diet talk to each other. So if you're eating really bad food, it's going to rev up the liver to make more cholesterol. So they sort of feed off of each other. But even with the best laid diets, we usually only see a decrement or a decrease in cholesterol of about 20-25% at the most. So somebody whose cholesterol is off the charts high, they need to reduce it by 50% or greater. Usually it's unlikely, unless they're following an extremely unhealthy diet, that diet alone is going to get them to where they need to get to. So usually we like to use a combination of diet, of course, but also medications that shut off cholesterol production in the liver in order to reduce cholesterol. So, stent is a way to open up the artery. If you think about a blockage in there, you kind of go in, put a metal tube in, that's the stent, and that opens up the artery to improve blood flow. But you have to keep in mind that the stent can block up in the same way that the blood vessel blocked up. And in fact, now you have a piece of metal inside the artery. So you have to be usually on a couple of medicines that prevent platelets, cells from sticking onto the stent. Those are called antiplatelet medications like aspirin and Plavix or other such medications until that stent sort of coats over. But more importantly, you want to control the underlying risk factors that that would prevent the stent from blocking up in the same way that the artery blocked up: the high blood pressure, the diabetes, the cholesterol, the smoking, all of the things that we know can reduce risk of heart disease. Hopefully just as it was before, except he's going to clean up his act a little bit, and the stent, when it's put in at the right time, and thankfully our stent technology has gotten so good, it's a minimally invasive procedure. I'm really hopeful that it stays open for the rest of his life. He doesn't have to think about having another procedure or bypass surgery or anything like that afterwards. But I hope that this has been the kick in the butt that he needs to get himself on cholesterol medicine, make sure that his risk factors are well controlled, and just make sure that he's being more cognizant of his cardiovascular health. Because we know that 80% of heart attacks and strokes are preventable with lifestyle risk factor modification. and it's the number one killer. So it's really, really important for us to take this as a wake-up call that heart disease doesn't spare anyone, even the movie stars and the actors. And it's important for all of us to take responsibility for modifying our own risk factors.